I'm like, we've got to address this. Patients being price sensitive. That's what they said. They're shoppers. They're looky-loos. They only want to do with insurance covers. They tell me they can't afford it. I have an older population, so I have to throttle my practice. And my gut is like, no, you don't. It has more to do with what's going on in your head than what's going on in the patient's. Now, let's call the situation what it is. People are price sensitive. It doesn't matter if economy is low or high. It doesn't matter. If you've got an unlimited amount of money, you still have a limit. Everyone is price sensitive. So it doesn't come down to the money. What they're telling you is a value proposition and failure to get them in the right position to where they can value what they need for the dentistry they need. So we're going to dig in today and just kind of cover some of those objections. Like I can't afford it. I only want to do what my insurance does. Sticker shock. Oh my gosh. So the first thing I want to just bring up, we really need to acknowledge this situation, is when it comes to money, when people go, that's a lot of money. Here's the deal. That is not a no. That's worth saying again. That is not a no. We have the right to have that emotional experience when something's more than we thought. Now, what we do as the office presenting that treatment has more to do with our head at this point, is we've got to find a way to make that happen for them. We need to not freak out. We don't need to go through, oh my gosh, they're only going to cover what insurance covers. Or when they call in and we look and say, well, they have the XYZ, they're not going to cover anything. This patient's not going to want to do it. This is not a good patient. I want you to put all that aside. Take a breath. Let them have time. All of us have a different way of processing things. I like to buy nice things, but I will go too, because that's an emotional response. I'm allowed to have that. Now, if it's valuable to me and if I want it, I'm going to figure out the way to do it. Now, if the salesman on the other side of the aisle says something stupid at this stage, or backtracks, or seems a little wishy-washy, my brain, without even thinking about it, even though I'm in this business, is going to say, hey, maybe I don't need that. Maybe I don't want that. Maybe that's not the best choice for me, because they're sending signals. I'm not saying that out loud. My brain's not even processing it, but that's subconscious, okay? So I want to make sure I'm not putting my own emotions into it. Give them time. Second thing we need to, in this situation, is we're at that stage 99% of the time. We did not set the expectation at the beginning before we give that number. When they first called and made that appointment and told us they have XY in insurance, or I want, money's an issue. If they're giving me those signs, I want to make sure anyone who's going to talk to that patient and me as the doctor knows that. They've already told me that information. So when I'm doing the discovery and I see that they need this, they really need that root canal, they need that buildup, they need that crown. When I'm talking to them, I'm making sure I'm hitting on the need and the value of those, because I'm going to ask what else is valuable to them. Money's an issue. How valuable are their teeth? Do you not want to lose this tooth? If you did lose this is going to cost you X, Y, and Z down the line. I have that information so I can be planting it. Right now, we're still at the beginning of the year. And so for a lot of people, it's time to revisit educating about insurance. And I'll tell you, I go into a lot of offices, and I call a lot of offices. I'd say 90% of them suck at this because they just take the insurance and they sweep it under the table like it's going to cover everything. We take that time to, go through and remind patients about their insurance. We take it as a quiet time. We don't do it on the phone. We don't rush them there, but we take it as a quiet time. Just want to remind you, Betty, you have this insurance. I've done the analysis, complimentary. I've gone through and done your insurance audit. We want to get you the most out of your insurance. You're paying for that benefit. I want you to have that. So we're going to work with you to get every penny out of it because it is your insurance. And if you don't use it, the insurance company gets it, and we don't want those guys to win. I'm positioning it as us versus them. And I'm going to talk to them. I'm re-educated. Even if they have the same insurance and the same coverage, I'm going to represent it a different way. I'm going to have that talk to them. If it's a new patient, that gives me an opportunity to do that too. That first visit is not to jump on them. The third thing I want to go back and bring up on that is I bring it up to them when they have something going on and say, like, Betty, I'm here to help you any way you can get this done. To get this done. You need it. You told me you want it. We have different ways to do it. We can do this as fast as you want or as slow as you want. So I give them control over that. I don't make them feel like I'm shoving this down the throat. And more often than not, we're doing a full mouth reconstruction, sometimes one tooth at a time, or they want to say, hey, it would be best for you, Betty, if I did this whole upper right together. So you get one visit and get all of that done, and we can chunk this down. Maybe we just do this part this year or this first 6 months. And we can do it that way for you, Betty. Or I can find a 0% interest rate for you so you can break this up because I know you wanted to get this done. I have those capabilities because we've already addressed that and making it through. So when I go through and bring that up. And then the last thing that we use with our clients, and I think this is really beneficial because it just kind of ties it up with a bow. It's easier on the patients, it's easier on the staff, it's easier on the doctor. We have what I call a bridge liaison. It's a special position. It might be somebody already working in the office, but they have special duties during that treatment plan presentation. And we have that person part of that process because they bridge that emotional decision where I've talked to them about what the need is. And then we've got that cemented psychologically, and it carries over into the treatment and the financial side. This increases case acceptance of 40% by having this person. The patient feels more comfortable. I feel more comfortable because I don't want to be the one, hey, you need this? I don't know anything about money. I'm going to let Mary come in there. It just sets that up for a really negative experience. And then I slide Mary in there and say, drop the price tag on them and let's see what they do. Who the hell is going to accept that? I wouldn't. It seems like you got shammed, okay? If you're genuine, which I know you are, if you care about your patients and their mouth and their health, I know you do, this is going to tie it all together. This is going to make that process a lot easier for you. And more importantly, it's going to be a lot easier on the patient. So don't take the surface remarks and make them cement or carved into stone and say, this is exactly how it is. You know, I had patients who told me, don't you dare tell me about cosmetic dentistry. And they had been paying just what insurance it would cover. And they said, don't you even mention it. And I asked them if they have something on their mind. We built that relationship. And those patients had the cosmetic services later on, because I made that option available to them. Does it happen instantly? Not always, especially if you haven't been doing it along. But I'll tell you, we got a lot of people who were on that fence who needed things to go on and do it. They had been in a patch and fill because someone was afraid to talk to them about really dental needs. If they want to keep their teeth, it's my job to give them the best option. If they say, no, it's not important to me, I said, that's fine, Joe. If it ever comes up again, do I have permission to revisit it? And nobody told me no. Nobody did, but I asked for that permission. So don't take it as surface value. Don't chisel it in stone, and don't make a hard no, because it's just a momentary situation. And the job of us as a dental practice is to find a way to get patients the treatment they need, find the time to do it, all those other things. So just get out there this week and change your mindset on that. Rephrase things. Have some conversations with yourself first and then with the rest of the team. I said, you know what? Is that really real? You know, we're pissed off. We don't want to deal with Joe. And so we say Joe's an idiot and he just wants to cover what insurance covers. No, it has more to do with us. I know you can do it. I believe in you. Reach out to us. This is what we do for our clients. We build the patient journey. We get more patients who need that treatment to that yes, so they can get it filled. And everyone feels good about it. I know you do great care. I want you to be able to give it to more patients. Come ask about that patient journey discovery and how we map it up for our clients. Reach out to my people at results@gingerbratzel.com, and we will give you the information on it. We'll talk about it, and we'll get on a discussion on that. So for today, that's all I got for you, but it's a lot. Take care.